Thank you for joining me today. My name is Joy Hooper, and I've been a certified wound ostomy continence nurse for over 20 years. And in that time, I've seen many innovations and changes concerning ostomy management. Today, we're going to talk about a new standard of care for ostomy patients, caregivers, and healthcare professionals. It's called hygiene-centric ostomy patient care, and an essential component to this process is a new device called a pouch replacement cartridge. The cartridge is placed over the stoma during any treatment of the stoma, such as changes or assessments, to capture any effluent and contain the odor. So basically, when you take off the pouching system for any reason, you would wipe away the effluent from the stoma, place the capture cartridge over the stoma, and the soft absorbent fabric on the inside will capture the effluent on the inside of the cartridge. So this is what we're going to talk about today. So let's get started with the presentation. This is the basic flow diagram. And the basic steps are preparing, and by that I mean preparing all the supplies before removing their current pouching system. And once the supplies are prepared, remove the pouching system, cover and contain any of the output during the process, allowing for more time to clean, dry, and then replace the pouching system. The pouch replacement cartridge works with a one-piece or a two-piece pouching system. Now let's take a look at some nurse and caregiver options for using the pouch replacement cartridge. Option A is with the patient standing up, and this is a very common way, where the patient is standing up and holding the cartridge if possible, and then the nurse or the caregiver is sitting down near the supplies and applying the new pouching system. Option B is lying down. Now what we recommend is that the patient is propped up and not lying down horizontal. That way the cartridge can be removed without any spillage. But note there are instructions about using a tissue underneath it when removing it from that angle. Now option C is with both sitting down, and if this is the preferred way, it's important to remind the caregiver to smooth out the skins and creases before applying the new system. And then option D is the patient sitting down on the exam table. And you can have them lean back, flatten out that skin, and allow it to be inspected and allow for a new pouching system to be applied. So you're wondering about those irregular shaped stomas, huh? Well, that is a common question. And what we ask the patient to do is to take a picture of the back of their skin barrier, their wafer, the way that they prepare it for application, and then email the photo to Stomagenics. And Stomagenics will convert it to a 3D file and will print multiple custom adapters that will fit the open end of the cartridge. And there is no charge for those custom adapters. Now for patients with irritated or sensitive skin, the cartridge solution is to pull the super absorbency out and curl it back over the end, as you can see here, or you can see on the image below on the right. And this will give a nice absorbent cushion against their skin. And note here to be very careful when you pull the fabric out, not to pull it out too far. Just slightly roll it over the edge. That's all that's necessary. Now let's review some common reasons you would want to use a pouch replacement cartridge. And we can begin with the desire for a more hygienic pouch change, especially for those with uncontrollable output. When you're pouching a stoma with uncontrollable output, it can be really difficult to clean and prepare the peristomal skin, and you're going to need to keep the stoma covered to prevent any effluent from contaminating the peristomal skin. Typically, we use tissue to hold back the drainage, but before long, the tissue becomes saturated and you have to reach for more. Well, using a pouch replacement cartridge instead of the tissue can make this change so much easier. And for somebody that has drippage during their application, well, a common thought would be that a pouch replacement cartridge is just for somebody with high output, but no. Even those with a little bit of output during a pouch change, when you think about it, a little bit of stool will go a long, long way on that clean peristomal skin. But if you do have high output, well, it's obvious how handy this pouch replacement cartridge can be during pouch changes. So people with ileostomies or urostomies can certainly benefit. But then again, the person with a colostomy, they have problems with diarrhea as well. Now, if you're overweight, you can have alignment problems because you're not able to see the stoma or to reach the stoma. So holding the cartridge in place and then sliding the skin barrier down on top of it can make an application so much easier. Also, helping with self-application. People that are applying the pouching system on their own, well, they can use the pouch replacement cartridge, as I said earlier, to help slide the skin barrier down into place, giving them a more secure fit. For somebody that's visually impaired, well, they can feel for the location of their stoma, place the cartridge over the stoma, and then they can slide the skin barrier down over the pouch replacement cartridge and secure it to the skin. And this can help lead to giving this person a better chance at independence. So now let's talk about the reasons why clinicians would want to use a pouch replacement cartridge. And the most important part of providing the patient's care is providing it with patient dignity and respect. And when a patient comes in for a treatment, they're really nervous about taking off their system and spillage and being embarrassed. So covering the stoma with a cartridge is providing that dignity and respect for the patient. Also, again, reducing that patient's stress. So many times they're stressed that when they come in for a visit with a stoma nurse, there is potential of having an accident, having spillage during that pouch change or during that assessment, and it actually causes that person stress. As we said earlier, reducing odor during pouch changes. Reducing odor can just make this a whole more dignified situation. Improving workplace efficiencies, helping to stay on schedule by not having unnecessary cleanups, and being able to conduct this examination without unplanned messes. Giving a more sanitized working condition for clinicians and containing output reduces the possibility of room or person contamination. Also, improving the patient satisfaction results. When patients have that more comfortable pouch change and a better experience in the clinic. Now let's talk about insurance and Medicare reimbursement. The pouch replacement cartridge is sold by Stomagenics and is available in 12 different sizes. This chart shows you the different sizes that are available. The patient is allowed 31 pouch replacement cartridges a month, and it's covered by most insurance companies and Medicare. Thank you for joining us today. I hope you've enjoyed learning more about the pouch replacement cartridge, and I hope you are ready for a more hygienic pouching change.